This ASCO podcast provides observations and commentary on the JOP article 2009 National Practice Benchmark Report on 2008 Data. My name is Elaine Towle. My discussion is titled 2009 National Practice Benchmark Report on 2008 Data. I am an ASCO volunteer and consultant, and I work as the Director of Consulting Services for Oncology Metrics in Fort Worth, Texas. Oncology practices are experiencing increasing economic pressures as costs rise, the number of patients needing services increases, and reimbursements from payers remain flat or sometimes decrease. Many practices have responded to these economic challenges by examining their business processes and making changes to improve efficiency and decrease costs. And the need for meaningful benchmarks to use in this process has grown. We're happy to present these results from the 2009 National Practice Benchmark as a tool for practices to use in their benchmarking efforts. The 2009 National Practice Benchmark includes responses from 198 practices in 41 states. The number of responses to any individual question varies between about 50 and 198, and the data in this survey was collected for calendar year 2008 or the most recent fiscal year for the reporting practice. The types of data we collected include practice demographics, financial data, operational information, staffing data, and information on services rendered. When comparing the 2008 data to 2007, we clearly see increases in total practice revenue, total practice expense, and the cost of drugs. Notably, but probably not surprisingly, the rate of increase for both practice expense and cost of drugs is significantly higher than that of practice revenue, and this is a key to the financial pressures that practices are experiencing today. Survey respondents were asked to report the number of full-time equivalent staff in several categories: total staff, billing staff, and chemotherapy administration staff. Detailed definitions were provided for each of these categories. Staffing levels appear to be virtually unchanged from 2007 to 2008 in all of these areas. The authors believe that this is representative of the changes that practices are making in this challenging economic environment. While volume of services provided is increasing, practices are focused on improving efficiency and are not adding staff and therefore not adding additional expenses. We believe that while the economic pressures of the last several years are significant, many practices have been able to adapt and continue to provide services to most patients. These adaptations include gains in efficiency that have been significantly funded through reductions in physician owner compensation. While we did not collect physician compensation in this survey, we have observed significant reductions from 2007 to 2008 in the area of around 20% in other data populations. So the reductions to physician compensation are real. Business and operational benchmarks, such as those presented here, continue to be valuable tools for the day-to-day management of oncology practices, but they're not enough to answer the questions being posed in the ongoing national discussions of healthcare reform, questions about quality of care, comparative effectiveness, and outcomes, among others. At the practice level, these specific questions and others like them can only be answered when business and operational data, such as the data collected in this survey, are linked to clinical data that's found in the practice electronic medical record. Today, there are a limited number of practices with fully functional electronic medical records, but that number is expected to increase over the next several years. And when that happens, the true value of benchmarking for both business purposes and patient care will be optimized. This concludes this ASCO podcast. Thank you for listening.